Thank you, Hannah, for that warm introduction. Welcome, everyone. It's a pleasure to talk to you today about effective vector-borne disease surveillance and control. The Asia-Pacific region of the world has been and continues to be strongly impacted by vector-borne diseases. Now, what do I mean by vector-borne disease? Well, I'm talking about any disease that is transmitted to humans from an animal or an insect. As you know, Zika virus, a mosquito-borne disease, is currently in the news. But surveillance and control measures for all kinds of diseases are nothing new. This work has long been done by various professionals across specialties and organizations. Today, we're going to talk about what may be new to you, and that's taking advantage of the power of place as a key strategy for integrated pest management programs. Just consider things like tracking the spread of disease, targeting sampling and eradication efforts, and providing public education. These are all spatial and temporal challenges. Many of you are probably familiar with the impact of vector-borne disease on the world's populations. But as a reminder, it's been shown that more than 17% of all infectious diseases are vector-borne, causing over 1 million deaths each year. Billions of people are at risk for disease, and hundreds of millions become ill. Many of these diseases attack vulnerable populations like young children disproportionately. And the thing of it is, a lot of this suffering and death is preventable. So why do something now? Well, I could talk about advances in technology making solutions more streamlined than ever, and we will talk about that. But obviously, a great deal of attention and funding has been focused on vector control because of the Zika virus pandemic. Currently, Zika is in 70 countries worldwide, including 19 in the Asia-Pacific region. While Zika is endemic to 6 of those 19 countries in the region, it's new to 13 of them. Recent information shows that Thailand has recorded 350 cases of Zika, and Singapore has nearly 400, including some pregnant women, who may be at risk for having children with microcephaly, or smaller than normal heads. This can be a devastating outcome, since microcephaly can cause a range of challenges for normal child development. But like I said, it's not just Zika. There are other vector-borne diseases on the rise, including dengue, which showed a 60% increase last year in the Philippines and a 16% growth in the number of cases in Malaysia. Over the last decade, chikungunya has infected nearly 2 million people in just 5 countries. If there was ever a time to focus on vector-borne diseases, it's now. As we approach the work on Zika virus or any other vector, it's clear that geography matters. This map shows the probability of occurrence of the Aedes aegypti mosquito around the world. The Aedes mosquitoes are the ones that carry Zika, dengue, and chikungunya. We can use geography to figure out where Aedes mosquitoes are in the world by including information about specific climate preferences, seasonal changes, elevation, and other habitat characteristics. Creating predictive models from these data improves our understanding of disease spread and helps us to plan control measures. We can begin to answer important questions like, where is this vector's normal habitat? When do they breed? When are they active? Which insecticides are effective and where? And are there nearby human populations at risk? Still, there are challenges as we strive to respond to vector-borne disease in a unified way, given that there are many kinds of vectors varying across landscapes and carrying myriad diseases. In this webinar, my colleague Jared Schultz and I will show you how the ArcGIS platform can be configured to create a smart workflow around vector control and disease surveillance. So what is a workflow anyway? Well, technically, it's an organized and repeatable pattern of business activity that's been logically ordered into processes that get things done. Those things that need to get done in this case include performing surveillance, responding to public requests, delivering interventions, and providing risk communication and public education. Each workflow accounts for all of the people, competencies, and resources, both material and financial, that are needed to accomplish the task at hand. When you employ well-conceived, repeatable workflows, you'll increase efficiency, improve quality, and save money. You can also save time when you're able to respond faster. This graphic depicts the importance of faster response to health impact. Any small improvement in response time provides a huge impact on minimizing the risk to human health. Today, we'll show you how a Geographic Information System, or GIS, provides the framework and process for designing complete workflows. You can apply geography to your common workflows in vector-borne disease surveillance and control, from the observational science, analysis, modeling, and predicting, to policy development, decision-making, and most importantly, to positive action. When you use a web GIS, it transforms organizations because now there's a technology platform that supports collaboration in your organization so that everyone is using the same shared authoritative data and resources. We like to say that ArcGIS enables every employee, contractor, and constituent to easily discover, use, make, and share maps from any device, anywhere, and at any time. That's powerful when you're trying to coordinate multiple people and job functions to get work done. Furthermore, the GIS professionals in this environment are enabled with a modern platform to configure their applications quickly rather than develop them with multiple components and products that require coding and customization. The solution that Jared is about to show you is already configured for mosquito control work. But the point is that you can use that same workflow with minor configuration changes to address any vector control needs. So to be specific, you'll see applications that address call center and dispatch needs for quicker and efficient use of your resources. We've configured applications that will organize the work of your field staff and give supervisors the tools they need to review job status and make better decisions. And of course, there are apps that will perform analysis so that you can review the spatial and temporal trends in your data. You'll also be able to quickly and easily prepare visualizations and compelling education and risk communication messages for the public. So without further delay, let me have Jared walk you through these apps and how they all work together for an integrated approach to pest management. Jared?
Thanks, Dr. Garrity. All right, so I'm going to go ahead and walk through some of the capabilities in the ArcGIS platform to address an integrated vector-borne disease surveillance and control workflow. First thing I'm going to start off with here is our predictive analytics tools. These tools can be run from both the desktop with ArcMap or with our web-based tools. And what this tool allows you to do is go in and set a number of different parameters based on globally available data sets, such as mean temperature, that supports the 80s variety of mosquito, altitude ranges, land cover types, precipitation, and population, to go ahead and find target areas that are suitable habitat for the 80s mosquito. I already ran this model once here, and you can see the areas that came up. Well, now I'm going to go ahead and further refine it. So these are areas that are potentially suitable. But I'm going to go ahead here and bump this up to look at areas with a little bit higher levels of rain and in areas which are a little bit more dense with population to kind of target my overall efforts in the APAC area. When I go ahead and run this, what I can see is my model re-executes, and then I can find areas that meet this criteria. individual users can go ahead and substitute in additional data sets at finer scales, and other type of ancillary data sets that they want to use to target their treatment efforts and to kind of look and see where the habitat is that supports this particular mosquitoes. And again, all of these data sets that I'm using here are nationally available data sets. This kind of predictive analytics capability is key to the ArcGIS platform and understanding what is going on in the area that you're serving as well as surrounding areas. Well, the next thing I want to do is kind of go through a model workflow here that's supported by our solution offering that walks through the process that a typical organization that's either coordinating or handling all aspects of the vector control operations related to disease outbreaks or just routine operations in general. So first thing I'm doing here is I'm showing you my home page. So one of the keys to this integrated workflow is being able to get out in front of issues quickly and allowing the public to report issues in a timely manner directly from their smartphone when they're out in the field or back in their house. So here I'm going to open up this application called Report an Animal or Insect Issue. What I'm looking here is a portal homepage, an ArcGIS Online homepage, where I can share applications out with the public that don't necessarily need to log in to get in, but can report issues to my organization. So when I go ahead and launch this application, what you see is a quick splash screen and the ability to proceed as a guest. You can also use your social media credentials or log in with your ArcGIS Online account and go in here and see any issues that are reported in a particular jurisdiction. I can go ahead and explore issues that are maybe in the community where I'm at here, standing water, and I can, again, zoom in closer and see what's going on there and vote on it if I think that particular issue needs to be elevated and addressed quickly. Well, I can also go ahead and submit a report with all the different information and details here. And this is very nice to be able to do this from the browser. But the main power of these types of tools is being able to go ahead and submit these reports directly from your smartphone. So now you can see I have the same application available here on my smartphone, which knows exactly where I'm at. And I can go ahead in here and select an individual issue. Say I want to report a mosquito issue here. And the way this application is designed, it works in the browser or it works on your smartphone or your tablet with no coding required. It's a responsive application that works across device and platform. So I filled out a bunch of other information here, and you can customize this to collect whatever information you want from the public. And then it's automatically going to capture my location to see where I'm at. And I can see I have that. I can upload attachments and other issues, but I'm going to just go ahead and report this issue. As soon as I report this issue, it's now available to the responsible organization back in the office. So if I go back here, and we'll close this application up, go back to the home page. Now I access that application from this home page. It could be shared out on social media or embedded in an organizational website. But if I'm a user inside of this organization, I've got to log in into this online portal here. And so once I go into this portal, I can access a different set of groups. So say on this particular day, I'm in the call center, and I am taking requests in from the public, public information that's coming in. So as I get into work, I go ahead and access the appropriate groups here. These are all the different groups that deal with these types of vector control issues. And I go ahead here, and today I'm managing problems that are coming in and being reported to our organization around vector control. So I go ahead and open the Vector Control Problem Manager application. And what I quickly see is everything that was submitted to my organization. Typically this could be done via phone call or email or website or other mechanisms. Well, now with this mobile capability, people can submit issues in immediately. So now I see this issue that was just submitted, a mosquito report. And I go ahead and click on this report. And I want to edit this information and look it over in more detail. So it's a mosquito issue, lots of mosquitoes. It's the property owner. It looks like I've got all the information I need to go ahead and route this to the correct department. So what I'm going to do is go ahead and mark this as in progress. If I needed to follow back with the end user, I can mark it as received and followed back, and that information is visible to the public. I want to assign it to vector control because this is clearly a vector control issue, and I want to get that department working on it. So go ahead and hit save. So now I've taken this issue that was reported in and instantly routed it over to the appropriate department. So now let's go here and assume the role of a vector control supervisor. So I'm as a supervisor tasked with going in and looking at all these issues that are being reported in and then routing them appropriately to the correct resource in my organization. So I know that any issues that come in here are assigned to vector control because this map only allows me to see what I need to see. So I can see two new issues that were reported in here. Let's go ahead and take a quick look at these, and they were routed from the department. So I've got a mosquito issue in this particular neighborhood reported by the property owner. All right, and I've got another issue here reported of standing water. As well as a little photo here that was submitted in from somebody's smartphone. So I look at that. Okay, I see some standing water in the area. All right. And I see that I've got a worker in the area. That's good. But I also see that I have an exclusion zone over here. Click on the exclusion zone, private neighborhood, organic farming and bees. Okay. All right. So I've got all the information I need to kind of move forward and address this issue. So let's go ahead and zoom in here. First thing I want to do is kind of mock up a treatment area to guide my field worker on what I want them to do. So let's go ahead and create a new treatment zone. I'm just going to quickly draw a quick polygon around these two areas. And I'm going to go ahead and say we're going to do an adulticiding in the area. The treatment method is going to be a truck-mounted sprayer. I want to make sure that this is completed very soon. So let's give it a complete date of tomorrow. And I can add additional description and notes, but for right now, I'm just going to go ahead and do that. Close. And then I'm going to go ahead and assign a site for somebody to follow up on this immediately. The site is kind of the basis of what I use to task people in the field and create assignments in later steps. So let's go ahead here. Let's go right in the middle of this treatment zone, and I'm going to use today's date, 10/11/16/001 for site. The site type, it's actually a treatment and a sampling because we've got some standing water there and we want to do some treatment. The site status is active because I'm going to assign it. I could put a description in there, but I'm not going to. It's ad hoc based on a customer request. I could record the address, but the beauty of using GIS tools is that the location's automatically recorded. I'm going to immediately assign this to somebody and close. So now it's nice. I went ahead and created a treatment zone in the area. I see that I've got a worker. I've got a site assigned. I could overlay other information in here. And if you see, if I zoom out, I can see information on past sites that have been treated by individual workers, other exclusion zones, and other type of information. I can overlay all sorts of information in here to make sure that everybody has what they need to make good decisions. All right, so after I've got this initial step done, next thing I want to do is go ahead in Workforce, and I want to go ahead and get this assigned to somebody. And so now when I go into Workforce here, I can see that I've got these two customer requests that have came in, and then I've also got my site, and I've got a worker in the general vicinity here. So I know that this means that I need to assign the site. So I'm going to go ahead here, click on my site. I know all the other information that's there, and I'm going to create an assignment. This assignment will help me route my people in the field. So let's pick an assignment type. Again, this is another surveillance and treatment, and that's what the field worker needs to know. I'm going to go ahead and assign it to Mr. Schultz because I know that he's right there in the vicinity. Let's give it a medium level priority. It's not a big emergency, but I want to make sure it's completed by tomorrow. I'm not going to be so prescriptive to put a time in there. And I'm going to put an ID in here so I can link the assignments back to the sites and everything else in the future. 10/11/16/001 and create assignment. So now what I've done is effectively create an assignment that's instantly routed out to my field worker so that they can respond accordingly. They don't have to call into the office to get their information or do anything else. So let's go ahead and now assume the role of a field worker. So I'm no longer the public reporting an issue. I'm now a field worker in this organization that's going out and doing treatments. Okay, so now you can see what pops up on my screen here is a surveillance and treatment. As soon as that an assignment is routed to me back in the office, I get it out in the field. So I can go ahead, and this is the only assignment that I have right now. It's non-critical, but I'm going to go ahead and address it, and I can see that it's only 1/10 of a mile away from me. I can get some of the basic information, and I know as I get closer to the site, or once I get on site, I'll have access to all the information I need to resolve this properly. So I'm just going to go ahead here, and I'm going to click Start to notify the supervisor back in the office that I'm on this, I'm addressing it, and I want to start collecting data at the location. All right, so I'm a field worker now, and I just knew that I had an assignment, but I want to go ahead and see what's going on here with this assignment. How did this come to be? First thing I do is, I kind of look on these customer requests and see what was going on. Lots of mosquito spray requests reported by an individual end user. And then I've got another request here, report of standing water. Okay, that's good. And then look here, and it looks like that my supervisor has set up a treatment zone plan. It looks like it's 7/10 of an acre, almost 8/10 of an acre for truck-mounted spraying. I got it. So now I'm going to go ahead here and click on my site. And I want to go ahead, and first thing I want to do is take a sample. I've located the standing water in the area, so I'm going to go ahead and take a sample of that, and let's go ahead and test and see what's going on with these, what type of variety of mosquitoes these are, and whether or not they're testing positive for any particular virus. So let's go ahead here, create a new sample. Let's go with the sample ID, and I'm going to use the same ID that I'm using for the site, so I can link this back 10/11/16/001. Every organization is going to have their own naming convention here. Oftentimes these sample IDs come off printed vials or bags. Sample type, it's going to be mosquito larvae because I'm sampling this water. And description, I could put more description in here, but I'm just going to go ahead and leave that as is. And I can also go ahead and capture information like a photo directly in the field. So let's go ahead here and add a quick photo. And use this photo, and I'm automatically capturing my location here of where I'm at when I'm taking it, so I'm going to go ahead and submit. So went ahead and allowed the field worker to take photos of what they're doing in the field and instantly submit this back into the office for instant analysis, verification, and review. But I also want to do a treatment in the area, so I'm going to go ahead here, click a treatment. And the treatment area, as I saw from before, was about 8/10 of an acre. And you can record to whatever detail you want if you want to use it for inventory tracking and other purposes. I can record the exact chemical or the type of chemical that I'm using. And again, this is completely configurable. The chemical amount, I'm doing a 4 fluid ounce per minute spray regimen here. And the treatment description, I could put some more information in there. But I'm just going to go ahead and log treatment type and the treatment method here. All right, so now I've recorded all the information that I need. I can also go back here on the map. So I did this treatment. I'm not in the exact spot that I was before. So I'm going to go ahead and mark a little bit different spot, because I treated right along the road here, and submit. So now I've taken all my treatments and samples in the area and submitted that back to the office. So if I can then return back to Workforce, mark this individual task as finished, and now the supervisor knows that I could be assigned additional job duties and responsibilities here. All right, so let's go back to the office now and kind of round out this workflow. Okay, so what's the next thing that I need to do here? I've now taken a sample in the field, and I need to route that sample via my normal protocols back to the lab. And the lab can go ahead then and find that sample. Let's go ahead here and refresh our map. And again, the lab would go into the same portal and access the lab group that they're used to seeing. So every one user would only have the groups that are specific to them. They only see what they need to do their job. And I can see that, I had a sample and I've got a sample number on it here. So I can, go ahead and search and find that sample quickly using my search tool here, or click on the map if I know the location. But I'm going to go ahead and click on the sample. And yeah, it was a mosquito larvae sample taken on this date by an operator that information was recorded directly in the field. So I'm going to go ahead here, and on today, I went ahead and identified this. This was the Aedes albopictus mosquito variety. In the individual sample, I found 55 larvae. The virus test date was also today, and the lab result came back as positive for dengue. I could have other disease types in here, such as chikungunya or anything that a particular organization wants to track. It's completely configurable once again. So let's go ahead and submit. And so now I have this information. I can also go in here and look at any other sample that's been taken, along with the sample results on what was found in the particular area. So it's a very powerful tool to get all your information geo-referenced in the ArcGIS platform. Well, now let's take the next step. So, we've done our vector control activities, but we've also got the public health side of my organization that's tracking this outbreak in real time, related to where they're having reported cases, whether they be travel-related cases or local transmission cases. They want to share this information across an organization while protecting patient confidentiality. So they're sharing this application, pulling it out of their disease registry, and entering in here at a 3-digit zip code to give everybody in the organization insight into what's going on. So here, let's go ahead and say that on this particular day, we've had some additional reports for the past week of different types of disease types here. So let's go ahead here and maybe click on this location of the state. And on this report date today, we do have some dengue cases, or maybe let's do Zika here. And we've got 3 cases that have been reported. And I'm tracking this by MMWR week, which is mortality and morbidity weekly report, which is a specific tracking mechanism used in the United States. This can be configured for whatever type of reporting schedule is needed. So I'm going to go with MMWR week number 40 and submit. So I can record information in here for every disease and every week or reporting period, so then it's then available to other people inside of my organization. So I've entered all the information that I need here right now to make some better decisions and really understand what's going on here. So now I need to expose this information and make it available across my organization. So here, the first dashboard that I have, it's a configured operations dashboard, basically is showing me very quickly the status of my field operations. I can see all the requests that have came in, and what kind of requests. Are they standing water, mosquitoes, or what exactly the request is about. I can see here with the quick filter any requests that are more than 5 days old, because we need to make sure that we're responding to these requests. And again, I can set these filters however I want. And then I also see all my other information, and I can limit this dashboard to display whatever I want on my individual sites and my assignments. I can also go in here and see all of my staff on how many open assignments they have, as well as all my open assignments, which ones are assigned, which ones are in progress, which ones are unassigned. So I can kind of, make sure that I'm effectively responding to issues. Again, I can go ahead and overlay a number of other layers in here and look at this information in relationship to things like, aerial imagery or whatever it is that I need to do to just get a better idea of what's going on, as well as, click in on any one of the individual points to get some more information. Well, that's kind of the status of my field operations, but I want to kind of share out across my organization, maybe with my public preparedness group, my infectious disease group, as well as my executives and other people on exactly what's going on with my surveillance activities. Where am I finding these species, Albopictus and Aegypti? Where are the species testing positive for different types of viruses? I've got this rolled up into a heat map as well as the individual points. And again, I can go ahead now. Let's look at some of my other tools here. I can go ahead and see that, for the entire time period right now, I have 75 total cases of vector-borne diseases. And I'm looking specifically at Zika and West Nile virus. I could easily configure this for chikungunya or to roll up the dengue numbers or whatever specific things I want to track. I can also look at this information by the individual zip codes for whatever disease that I want. Or I can go ahead here and filter across time. So let's go ahead and look at, not all weeks, but let's look at the first 3 weeks of the year. And I can see what was reported in that time period. Then I can also click on any individual point here and see the samples that were taken in that area. And whether or not they tested positive, and if they did, for what disease. I can get more information on the individual areas here. I can see that this 3-digit zip only had one reported case in week 1 here. If I look at some of these other ones, I can see maybe that there's additional reported cases across the weeks that I've filtered out here. And again, if I go ahead here and click to all, then all of a sudden I'm getting every reported case. So this is just a nice way to roll this information up so it's easily understood. Well, sharing this data internally is very important, but also sharing it externally with the public. Oftentimes organizations have different websites and tools they use to share and educate the public. So with using things like story maps, we can go in and kind of share out our main page in our organization that we've already stood up that has all the information on the services that we're offering, but also go in here and provide links to tools and resources that maybe the Center for Disease Control, my state level partners, the World Health Organization has available. So rather than recreating the wheel, I kind of work with my partners. I can overlay information, say services that the Center for Disease Control made available on, global range for the Aedes mosquito, and overlay on there specifically the information on where I'm finding those mosquitoes. I can also communicate out with the public the results of my inspection and treatment activities here. Again, I've animated this data here to just provide an example showing, where I've done treatments over time. And then I can click on any one of these cases. I can see every customer request, the status of that request, and what's going on at individual sites. Now, not every organization is going to want to share at this level of detail, but I just kind of provided this example to demonstrate you have complete control over what's shared, and you can animate it across space and time and really communicate with your end users on what's going on here. So that's kind of my inspection and treatment activities. Well, the other information I want to share is the results of my surveillance and monitoring activities here. So what here you can see is all my areas where I've tested a mosquito positive for a particular virus, what the virus is, and when the test was done. I'm displaying this as both a heat map or an individual point, depending on what level you're comfortable with sharing. And then I can also go in and click and show individual users, how many cases of vector-borne diseases we found in those individual areas here. And then, to help educate the public, I can provide resource locators, maybe 211, if that's where you're providing information on where to get different resources, or if I've spatially enabled the location of my drop-off locations, my districts, or maybe I'm even sharing out fogging routes and other type of stuff. It's all can be embedded here and made quickly available in one type of interactive tool. So kind of the last piece of this puzzle that I wanted to show you is something called our public information map and our social media monitor. So I can kind of internally look at this overall area that I'm serving, and I've filtered social media based on different keywords here. So I can go ahead and look for, mosquito or Zika or insect, and look around the area that I'm serving here. and get information on what people are reporting. Are there water line breaks in particular areas? Is there a big bug problem in an area? Or is there a lot of people in a particular neighborhood concerned about a particular disease or outbreak or some type of information that I can kind of get out in front of, and help educate my end users? So that's a useful tool there. Okay, so that's kind of the overall capabilities. Kind of want to recap, what I just showed you here. I showed you an ArcGIS online portal that gives you the capability to provide self-serving mapping and analysis across your organization. So not just GIS analysts and mapping specialists, but your epidemiologists, your lab, your field workers can all use this tool to share and collaborate. It's a scalable cloud-based environment that allows you to configure apps without writing a line of code. There's some links here if you want to find more information. That was the portal that made all this information available or accessible. I used a number of different configurable application templates and solutions. I used some of our crowdsourcing tools here to allow the public to report issues that could then be routed back to the correct department. And I used it to record the lab results as well as the status of the cases across the geography that I'm serving here. I also used a public information map to monitor social media. And again, here's some links where you can find some more information about each one of these. I used Web App Builder for ArcGIS, which allows me to develop a kind of customized application that is completely developed from configurations that allow me to brand this for my individual organization and select the tools and pieces that I need in order for individual departments to do their job. Again, it runs on any device anywhere, completely configurable with a number of widgets that allow you to accomplish your end goal. Then I've got Workforce. Workforce allows me to coordinate all my field workers and management so they're all seeing the information they need to get their jobs done. It's very agile. I can assign things to people right out in their field and change and see what's going on. And it provides me a complete real-time view of what's going on. I don't need any type of special mobile device for people to access it. Right now this particular tool is available on the iOS as well as in beta on the Android platform. And it integrates with other applications such as Navigator, and Collector, which we went through. And Collector allows me to pull this information, take photos in the field, access all of this information, and replace my paper-based process, have my information immediately accessible, and takes advantage of what's available on my phone, taking over those controls in this mobile environment. And then I showed you a couple example configurations of operations dashboards to track the status of field operations as well as the extent of my surveillance activities. This can easily be integrated with other systems and provide real-time capabilities and insight. And then I showed you a story map, which is just one example tool in the ArcGIS platform that can be configured to give you this type of interactive multimedia environment to display data over space and time. And with that, I'll turn it over to Esri.
Thanks, Jared. I hope that everyone is starting to see how location information can be used strategically in every step of the process. Let me now spend a little time with just a bit of light tech talk so you can see why using an entire system or platform makes all of this possible. First of all, it keeps everything under control. Each user has an identity or a personal login. That does a few things. It keeps people accountable and ensures that unauthorized individuals don't get access to sensitive information. But it also allows people to keep their relevant information right at their fingertips. In this system, people can easily discover data and information about all of their assets or their work tasks that need to get done. We believe that getting the map you need should be as easy as searching the internet. You can also put those maps to immediate use on any device, whether your work is in the office or in the field. You can answer new questions by mashing up maps and data to create relevant decision support materials. Teams will have a collaboration space so they can share and use their maps as a group. And since the platform is about configure first, as I mentioned before, it can grow or scale as your business challenges change or expand. You don't need to contract with a developer or some specialist to make the map you need. This platform is stable, it's the industry standard for mapping, and it's meant to grow with your needs. All right, so now let me share with you a few examples of organizations that are solving vector-borne disease surveillance and control problems with ArcGIS. My first example comes from India. The National Institute of Malaria Research has been doing work with GIS to improve their understanding of mosquito habitats and breeding sites for both malaria and dengue. They perform regular surveillance activities and watch for risk to nearby populations who could be exposed to these diseases. This helps them to plan for public education and any resources that may be needed when outbreaks occur. And they've ensured a collaborative experience by standing up a data sharing resource so that everyone has the same authoritative data for making decisions. This next example is from the Pacific Disaster Center, or PDC. They've been focused on describing the distribution of suspected cases of Zika virus throughout Latin America and the Caribbean. They collect their data from weekly epidemiology updates and bulletins that they obtain from health organizations worldwide. They also look at other kinds of information, like hospital density, rain, existing vector programs, and more. In return, the center publishes regular updates, including online maps that track cases and other kinds of data over time. This really helps decision makers to understand the scope of a region's vulnerability to any kind of disease, as well as their ability to respond. Here's an example that's pretty close to my location. This one is about Santa Cruz County. Now, they're located about 60 miles south of San Francisco along the California coast. They have some very diverse ecologies, from pristine beaches and wetlands to lush redwood forests and rich farmland. They have more than 14 different species of mosquitoes that they have to deal with, and they've used GIS for nearly 20 years to help them achieve their mission. One of the key programs in Santa Cruz is their mosquito breeding site inspections. Over the years, they've identified more than 2,500 breeding sites, and they use their GIS system to help them prioritize their regular inspections of the sites by providing reports of the last known inspection, the treatment history, and any new information like recent disease detections from their mosquito traps. Each year, Santa Cruz County finds new ways to use their very mature GIS system and take advantage of the suite of tools available to them. Now, I would guess that many of you have heard about Zika being found in Florida in the United States. Well, the Florida Keys, which is a set of islands south of Florida's mainland, has had to fight many vector-borne diseases like West Nile virus, dengue fever, and chikungunya. In this particular geography, they have to use a fleet of different kinds of vehicles, like boats, trucks, helicopters, and airplanes, to apply insecticide treatments on the islands. Their operations are made easier by using GIS to provide ideal routing for all of their vehicles and keep track of what's going on in real time. This helps them be more agile if they need to deploy a worker to a strategic site. And sometimes even the workers have emergencies. They've actually used their GIS system to promote worker safety by locating a worker's vehicles if they fail to check in at the assigned time. All of the example organizations that I've highlighted have really big stories to tell, but I hope that I've given you a sense that each one has used place-based information to work more efficiently and more effectively. And that brings me to telling you about some additional resources that we have for you. These include a white paper on vector-borne disease surveillance and control, a story map that will demonstrate each of the applications you saw today. We also have a website for you to peruse and a collection of mosquito management templates that you can download and use immediately if you already have ArcGIS software. While I said in the beginning that the workflows we use in vector-borne disease surveillance and control are all similar and repeatable, we also recognize that each organization may have a range of needs and a variety of ways they like to implement solutions. We can accommodate everything from a do-it-yourself model where you download and configure the mosquito solution templates to having professional services do the complete implementation for you and just about everything in between. So, if you saw something that you're interested in, I'd like to encourage you to contact us. I've put a lot of information on this slide. Jared and I can answer your questions in the next few minutes, and we're both really here to help. But to get in touch with someone who can talk to your organization about their needs, please contact Hannah Ruslan or Kanserina Kernia. And we're going to be happy to take your questions now. Thank you.